between Americans and other ethnic minorities who were also looking for work. Harry Anslinger and other political figures at this time started promoting cannabis as a drug used by these ethnic minorities.
By the time the word marijuana came into existence in the United States in the 1930s, it was the Mexican word for cannabis that was not considered hemp. Many Americans were familiar with cannabis extract, usually called cannabis indica, on the bottle. And instead of that, here's this new devil weed from Mexico, which nobody had ever heard of.
At this same time, many newspaper owners and other media giants who were also invested in the lumber industry didn't want a plant that could be used as an industrial fiber to compete with their means of getting paper. Many articles were printed that not only played up the racial tensions, but also the psychedelic effects of the cannabis plant.
And the result was in 1937, this new menace called marijuana was outlawed by Congress, which didn't know anything about it. And of course, there was a great deal of anti-Mexican prejudice during the Great Depression, simply because Mexicans came over looking for work. There was also a great deal of anti-black racism in the Deep South. Cannabis was used by African-American stevedores in all the port cities. There are cannabis cultures growing all around America, and when it arrives in America, it's considered a terrible thing that these horrible immigrant foreigners do. And immediately, the result of the passage of the Marijuana Tax Act in 1937 was to eliminate marijuana from the pharmacopoeia.
Today, marijuana is classified as a Schedule I drug. But back in the 1930s, before the ban, every major pharmaceutical company was selling it as a medicinal product.
This is the way that Parke Davis sold marijuana in the 1930s, but it is botanical drugs pressed cannabis sativa, made by Parke Davis with a nice picture of their manufacturing plant. They also made a variety of tinctures and other substances that were sold commonly in every little apothecary and drugstore in America. So it is not a new drug. That's the emphatic part of this. This is a drug with medical history that goes back far beyond the founding of our nation.
With the continued cannabis and endocannabinoid research being conducted around the world, it's a wonder how the United States government still continues to support the idea of no accepted medical uses. If the reason for continuing this label is due to the lack of research, well, then the government needs to allow for more studies that aren't just focused on how harmful the drug is. One such doctor in California who's researching whether or not cannabis is potentially helpful is Dr. Donald Abrams.
So my first research in the use of cannabis was done in 1997 when we looked to see if it was safe for patients with HIV who were taking the potent anti-AIDS medicines to use cannabis in association with their protease inhibitors. And we found that cannabis was safe, that it didn't change the level of the virus, and in fact, if anything, it improved their immune system.
It's also with the founding of the Center for Medicinal Cannabis Research that Dr. Donald Abrams was able to study potential ways that cannabis may be helpful in the medical field.
This Center for Medicinal Cannabis Research was able to fund clinical trials that looked at the potential medical benefit of using cannabis as medicine, because the only legal source of cannabis in the country is the National Institute on Drug Abuse, and they have a congressional mandate to only study substances of abuse as substances of abuse.
Contrary to the National Institute on Drug Abuse, some basic studies from the Center for Medicinal Cannabis Research are suggesting positive outcomes with regards to using cannabis. Another area where Dr. Abrams saw surprising results was with pain relief.
We took patients with chronic pain, who were on a sustained release opiate, either morphine or oxycodone. And we subjected them to inhalation of vaporized cannabis 3 times a day to see what impact that had on the level of the opiates in their bloodstream and on their pain relief. Although the study is too small to make any major claims, there is a suggestion that adding cannabis to opiates is synergistic. That is 1 + 1 = 5 instead of 2 with regards to pain relief. There's also increasing evidence suggesting that cannabis or cannabinoids may have direct anti-cancer activity themselves. And my friend and colleague Manuel Guzman in Madrid is a PhD laboratory scientist who's done a lot of the work to demonstrate that this has potential in the test tube. But I think we need to move it from the test tube into humans, and that's another thing that I'm interested in working on, because I've seen in my own practice and my own life some impressive stories. My dear friend Michelle Aldrich, basically her integrative oncologist, and I was very impressed with the effect that her use of a cannabis concentrated oil product had, in addition to her conventional treatment, in eradicating a fairly advanced lung cancer.
Without any backing from the government, but desperate to save their own lives, there is a growing number of patients around the country that are reporting that cannabis is healing their cancers and other ailments. A patient of Dr. Abrams, Michelle Aldrich, is one of those patients.
I found out I had lung cancer. It was diagnosed on January 12th of 2012. And it was overwhelming.
Diagnosed with stage 3A lung cancer, the normal survival rate for this type of disease is said to be 25% over 5 years. Unfortunately, due to Michelle's bulkier lymph nodes, her doctor said her chances were less than that.
And once you have bulky lymph nodes, it's reduced to 2 to 5%.
After finding out the bad news, Michelle's friends reached out to her and suggested she try an alternate medicine.
I got home that night and Jeannie Hara called me and she said, "You have to take cannabis oil." And I said, "Where do you get it?" And she says, "Valerie Corral from Wham down in Santa Cruz." So I called Valerie and I had it by Saturday.
Cannabis oil is a concentrated substance derived from a full pound of cannabis. It contains multiple cannabinoids from the plant, and although some people use this oil topically, in Michelle's case, she took it orally in capsule form.
This one in particular is called full extract cannabis oil. Because of the oiliness and the stuff, I put it in a gel cap every night. So February 1st, I started the chemo. I was going to have 4 chemos. And the night before, I started the hemp oil. And I did that all the time. My last chemo was April 5th. And the middle of April, they did a CAT scan. And they wanted to see what the chemo had done and whether we could do surgery or not. And the lymph nodes were dead, and the doctors were amazed because they didn't expect that. They wanted to be reduced so they could operate on the tumor, but they weren't expecting them to be dead. So they wanted right away to do the surgery, and I said, wait. Let me finish the oil first. And at that point, they said, okay.
With her doctors still deciding to go ahead and have the surgery, they were surprised at what they found once inside. Michelle's tumor was dead.
It's when he took out the tumor, it was necrotic core. So it was all dead. And he only took out like this much of my lung. A little resection, versus he was going to take out both lobes. That was most amazing. It was a miracle.
My experience with stage 3B lung cancer patients here at San Francisco General Hospital over the past 30 years is that we do chemotherapy and radiation up front in hopes that they can go to surgery, but most of my patients don't make it to surgery because their tumor progresses even with the chemo and radiation. With Michelle, she did the chemo and radiation and the cannabis oil, and when she went to surgery, there was no cancer, and she remains, thank goodness, cancer-free today.
And I want to wish everybody to go find it so they can stop it too. I mean, if I can stop lung cancer in 3.5 months, you know, people shouldn't have to go through years of chemo.
Besides Michelle Aldrich, who believes that she was miraculously healed by cannabis, there is another story of a woman who's defying the odds, and she believes it's her use of cannabis that has prolonged her life. This is Kathy Jordan, who has miraculously been living with ALS for more than 25 years.
I was diagnosed, and the first week of January 86. And by 89, I could barely walk across my house. And went from like Sunday, I could brush my hair, and by Friday night, I had to lay my head on the sink.
ALS, also known as Lou Gehrig's disease, is a fast-acting neurodegenerative disease that affects nerve cells in the brain and in the spinal cord. When the motor neurons die, the ability of the brain to initiate and control muscle movement is also lost.
It's a horrible disease. It's horrible. They don't know where it comes from. They don't know what causes it. She thinks of something. She wants to move her arm, but she can't because the signal's not getting from her brain to her hand.
Depressed about her diagnosis, Kathy even considered committing suicide until her friend told her to try cannabis.
So we got smoking it. I figured, what the hell? What's it gonna do? Kill me? I just thought I was gonna end my life. And I smoked it, and I literally felt, I would say it was like an electrical hum or buzz in my body.
Besides feeling better overall, Kathy also noticed that in the earlier stages of her ALS, when she used cannabis, she was able to walk better.
All of a sudden, I could walk across my yard again.
Originally, Kathy's husband, Bob, didn't like the idea of his wife using cannabis, but ultimately he too came around once he saw the positive changes in his wife's life.
I really did get upset. I thought, oh, Christ, we're going to go to jail. You're smuggling dope and all this stuff. And I really didn't understand it. And I kind of thought, well, she's really not doing good with her own demise. Well, but I'm not going to say anything. Just if that makes her happy, let her be happy, you know. And then I started seeing a change. And as time's going on now, she's aging naturally. What you've seen earlier is the devastation happened in the first 3 years. And then once she smoked the cannabis, it stopped.
Now, almost 30 years later, Kathy is beating the odds.
I get up every morning, I have 2 cups of coffee, I smoke 2 joints, and bring up any plant that I have produced overnight. I will cough, it clears my lungs. And the lung doctors are amazed. When you light up a joint, you inhale, you get cotton, which is great for ALS, because your main problem is saliva. You have an excess of saliva.
The appetite, the muscle spasms, her whole attitude, everything improves when she smokes it. And there's got to be something to it.
I just can't believe that now I'm 63. At 41, I was supposed to be dead. And then I think it was 96, we got a letter from the federal government. I had to prove I was still alive. I I actually said, you have outlived your expiration date. You must prove that you are alive.
Now, besides outliving her expiration date, Kathy Jordan fought for her life using cannabis in a different way also.
She said, I don't feel good. Well, I took her to the doctors, and she had a cancerous tumor in her stomach.
Desperate to save her life for the second time, knowing about the possible healing capabilities of cannabis, Kathy took cannabis oil for a few weeks before her surgery.
When the doctor operated, she said she never saw a tumor do what that tumor did was it turned on itself and cut its own blood supply off. And the only thing I can give that credit to is that oil that she took.
You survived surgery, which I've never seen an ALS patient survive surgery. And I mean, you have beat all the odds. And Dr. Will was just, like I said, he's been 35 minutes just pulling his hair like, oh my God, can I film you? Can I film you? I want to share again with my students. I said, yes. I said, I will even give you permission to say that the patient believes that cannabis is what keeps her alive.
I just wish they would study it and find out what's going on, because she's living proof that there is something. And anybody that knows anything about ALS, it is one of the most horrible things you can watch. We've met doctors, we met politicians, we met other patients. We've tried everything that we know how to try to get these people to open their eyes and study this plant. It's an amazing, amazing plant.
I have proven them all wrong. In fact, I really am outspoken, only because I realize my doctors are dying and retiring. I'm outliving them. I'm telling you, this has stopped my disease.
So how can all of these cases of marijuana healing medical conditions be explained from a scientific point of view? Well, perhaps, just maybe, we are wired for weed, so to speak, and there's a system in our body that combines to cannabis on a molecular level. To answer that question, along with many others, we're heading to Israel, a country who has been a pioneer in the cannabis research field. This is Dr. Meshulam, the world's leading expert in this field and the grandfather of the medical marijuana movement. It was over 50 years ago that he first isolated THC and CBD, the active and inactive components in marijuana. And today, it is his original work that has led to many groundbreaking advancements in the medical cannabis field.
When we started working exactly 50 years ago on cannabis, very little work was being done. People had looked into it, but didn't really know how THC works. At the beginning, we worked on the isolation, structure elucidation, and synthesis of both the active compound of many of the other compounds.
After years of working on this, Dr. Meshulam was able to successfully isolate the psychoactive component inside of cannabis called delta-9 tetrahydrocannabinol, along with many other chemical compounds of the plant, such as cannabidiol.
There are also other compounds there, and we had to devise methods for their preparation. So this took a few years.
Dozens of researchers around the world knew that THC indeed affected the user and made them feel high. But researchers didn't know how this process actually happened. It wasn't until 1988 that a U.S. researcher named Alan Howlett first suggested that there might be a receptor, something actually inside the brain, that THC binds to on a molecular level and that causes a series of reactions to start. This idea of having a receptor inside the human body that is activated by THC was confirmed years later by a group at the National Institute of Health in the U.S. This first receptor was located inside the brain, and they called it CB1. Then, in 1993, CB2, the second cannabinoid receptor, was also characterized. Shortly after the discovery of CB1 and CB2, Dr. Mechoulam identified anandamide, the body's very own produced form of THC.
In the early 90s, 1992 and later, we identified two compounds that are endogenous. They're present in the brain, they're present in the body, they activate the cannabinoid receptor. Actually, there are two receptors. They're of extreme importance. The first compound we identified, we called it anandamide.
Anandamide is a naturally produced molecular messenger molecule called an endocannabinoid. Anandamide has a three-dimensional structure that THC mimics. Think of them as organic cousins, if you will. Although one comes from the plant and the other is produced in our bodies, their effects on the brain are fundamentally the same.
Then later we discovered another compound, and these two compounds are the main compounds that stimulate the two receptors.
This they called 2-AG. The discovery of 2-AG was very important in that it established the existence of a cannabinoid system within the human body. So, to put it all together, the cannabinoid receptors called CB1 found in the brain, plus the CB2 receptor in the immune system, along with the endocannabinoids called anandamide and 2-AG, and all the other molecules involved, are a part of a relatively new body system that researchers are calling the endocannabinoid system. Today, it's the discovery of the new endocannabinoid system that researchers are continuing to study. The belief is that this new system, similar to a nervous system or pulmonary one, could be the key to keeping the body healthy.
Our body has a general protective mechanism against foreign proteins, namely viruses, microbes, and so on, the immune system. Now, how come we don't have a protective method, a mechanism, a system against other things? And apparently, the CB2 receptor, activation of the CB2 receptor, is a mechanism, a protective mechanism, including possibly cancer, including possibly mental diseases, schizophrenia, and so on.
This raises the question, why would a plant, the only plant in nature with cannabinoids, activate that same set of receptors in our body? By researching and working with cannabinoids such as THC and CBD found in the cannabis plant, researchers are able to gain a better understanding of how the receptors work and what role chemical compounds of cannabis play in helping and protecting our body. Dr. Mechoulam explains that one such important study was that of Dr. Manuel Guzman in Madrid, Spain.
He works on the mechanisms of cannabinoids in cancer. He does extremely important work. He also did a clinical trial in Spain against glioma. Glioma is a terrible disease. It's a brain cancer. He found that administration of THC to patients can prolong their life.
The major lines of research of our group are devoted to cannabinoids and cancer, cannabinoids and neurodegeneration, and cannabinoids and brain development. With regard to cancer, we are trying to envisage whether cannabinoids could be anti-tumor compounds to be given to patients with cancer.
And although THC is being used in the various studies and seen success in test trials, there is still concern about the psychoactivity of it due to its activation of the CB1 receptor. Well, one interesting fact is that cannabidiol, or CBD as it's known, another cannabinoid found in the plant, acts as an antagonist to THC and actually reduces the psychoactive properties. So for example, in the future, if THC or a THC-derived medicine is used to treat a disease such as cancer, CBD could, in theory, be used additionally to reduce the psychoactive effects of THC without taking away from the medical benefit.
Cannabidiol, as I said, is a non-psychoactive material, but surprisingly, it has all kinds of mainly positive things. It can lower some of the undesirable effects of THC. Cannabidiol prevents this.
On that same note, a whole range of scientific research is also being done on the effects of just CBD and the positive results it's having on the endocannabinoid system.
Cannabidiol, in addition, has its own effects. It is anti-inflammatory. We published a paper in the Proceedings of the National Academy of Sciences that it is a very potent agent in reducing the effects of rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease. An autoimmune disease is a disease in which the body has some things mixed up, and it attacks its own system. And there are quite a lot of autoimmune diseases. Another autoimmune disease is diabetes type 1. So we went ahead and looked whether cannabidiol is good against diabetes type 1. And we found in mice that it is very good against diabetes type 1.
Another area where CBD is seeing positive effects is in schizophrenia patients in South America.
This is important because schizophrenia patients can be treated with drugs, available drugs, but these drugs always have side effects. Cannabidiol shows no side effects. I believe that it will be used because it has been shown now in animal models, it has been shown in patients, so cannabidiol can be used and should be used. We identified, elucidated the structure of cannabidiol way back in 1963, exactly 50 years ago.
And today, much like 50 years ago, although the National Institute of Health approves grants from Meshulam's ongoing cannabis research, the U.S. government refuses to see the medical benefit in it. Aside from stories of patients around the world who have been treating and curing their own ailments, there is a wealth of evidence that shows an endocannabinoid system exists in the human body. One group that teaches this idea is Patients Out of Time.
Patients Out of Time is a 501c3 educational charity. We teach the doctors and nurses of the United States about the therapeutic uses of cannabis, also the general public, but our focus is on the medical professionals. We do that under the authority, I guess I can say, of the American Medical Association and the American Nurses Association. The way we do this is we have series of conferences that began in the year 2000. These conferences have been every 2 years, and they're accredited conferences, meaning that the MDs can get continuing medical education credits for attending, and nurses can get continuing education units for attending. It's a good thing that we do it. It's a bad thing that we, as a small nonprofit organization, are the only ones in the country that do it.
And the hope of these professional organizations is to really push the instruction in med schools, in nursing schools, in any kind of health schools, that it gets into the curriculum, and then it gets to continuing ed for all the people who are practicing now, because, as we've said, it's been a void in their education.
You need to understand you have this system. It's important, just like you have a nervous system and a pulmonary system, you have an endocannabinoid system.
Medical schools are not teaching about medical cannabis in schools yet. I mean, I joke with people, have you ever heard of endorphins? Well, 40 years ago, nobody had. Okay, you say the term endorphins, they go, what is that? Well, then they finally started teaching it after like 15 or 20 years. They started teaching in medical schools. And now the average individual, oh yeah, I heard of endorphins. I know what that is. Well, what about endocannabinoids? Who? What? They don't know about that. Medical schools aren't teaching it.
You cannot overdose on cannabis. They've talked about ways to possibly overdose. You would have to consume 1,500 pounds in 15 minutes. A little bit impossible to do. Another way of looking at it is they do the LD50, which means the lethal dose of a drug. When you're testing it, how much would it take of that drug for 50% of the animals to die, 50% of the humans to die? You know, and you have drugs such as insulin, not much of an LD50. You double a dose on somebody, you could kill them. You double a dose on digoxin, a heart medicine, you could kill them. Well, for cannabis, it was something like 20 to 40,000 times the normal dose, might be a lethal dose. So when you think about a medicine in that regard, it's just that safe.
Although medical schools may not be teaching about this new system quite yet, there's still many organizations out there that think that cannabis and its derived compounds may have medical benefit.
The primary discussion we're having with the Patients Out of Time is having right now is with the National Hockey League to consider cannabis as a medicine for head injury for their injured players. NHL has had the unfortunate circumstance of having at least 3 of their players in the last 18 months, former players, head injured former players, commit suicide. Cannabis is one of the few compounds that will pass through the blood-brain barrier. Therefore, that anti-inflammatory therapeutic value of cannabis can go right to the brain, and of course it would be immediately helpful if it was given right on the spot of the injury.
Besides the members of the NHL, another country that has already been testing this theory of cannabis aiding with brain trauma is Israel.
Initial science from Israel, again, who is a leader in this field, indicates that they have successfully treated soldiers on the battlefield with cannabis. From the doctor that made the report to us, it was administered on the battlefield in an oral mucosal spray. In other words, a soldier, an Israeli soldier, male or female, is head injured on the battlefield. Their medic administers cannabis on the field before they even go to a MASH unit. And they have found that this anti-inflammatory capacity of cannabis has greatly reduced the degree of the TBI.
From on the battlefield to off, the Patients Out of Time group also believe that there would be great benefit to administering cannabis products right here in the U.S. to veterans struggling with PTSD.
And one of the things that really gets me when we talk about patients and the use of cannabis and its medical value or not is when we put cannabis together in the same sentence with the United States military veteran. I'm a military veteran, and my wife is a military veteran. And what we have in the United States now are military veterans, injured, wounded people, physically and mentally, who are not allowed therapeutic cannabis because of where they live. Veterans are killing themselves by suicide every 80 minutes. And a lot of that is based upon depression from post-traumatic stress and TBI injuries that is exacerbated by the use of alcohol.
Aside from taking cannabis as a medicine to treat or heal a disease, there are many theories out there that suggest that due to our body's endocannabinoid system being involved in many different functions of the body, the use of cannabis might be a good preventative medicine also.
Anandamide and the other endocannabinoids are actually what you could also call a polyunsaturated fatty acid. And people in the dietary health world will recognize this as your omega-3, omega-6 fatty acids that are considered important for brain health as antioxidants. Both of these molecules are very strong antioxidants. THC is a better antioxidant than vitamin E. And there's some evidence that dietary intake of polyunsaturated fatty acids elevates and changes the levels of endocannabinoids in the brain and the body. That may be some part of the reason why a high intake of omega-6 and omega-3 fatty acids, like from fish oils, is health promoting. It might be helping to regulate and stabilize endocannabinoid levels as well. I think that's an exciting field.
The endocannabinoid system is literally involved in physiological processes throughout our body in almost everything we do, whether it has to do with appetite, whether it has to do with breathing, with the heart beating, with cells healing themselves. It's just amazing. People have looked at this endocannabinoid system being the thing of the 21st century. I mean, it's the medical breakthrough, and it's just going to lead to so much more understanding of the human body and healthcare in general.
So where is cannabis research heading in the future? Well, despite its label of having no accepted medical use, many companies out there are looking to see if there is indeed medicinal use for cannabis and its cannabinoids.
We hope that all this knowledge will also be translated into drugs. And quite a few companies are working on this type of drugs. There are companies in the US, I know that Abbott, major companies working on that. Second thing is probably cannabidiol will become a major drug. So here we hope that we shall see a whole group of new compounds. When people started working on antibiotics, there was just one. There was penicillin. Well, then there was an explosion. There were many, many dozens of compounds. Here we expect the same. We have THC, which is at present a minor approved drug against nausea and vomiting. And, but I hope, that within 10 years, 20 years, we shall have a huge number of cannabinoid drugs.
Cannabis, I think, is illegal because of economical and political and social issues. At the end, it was a kind of fight between three major drugs in the early 20th century: alcohol, tobacco, and cannabis, and the winners were alcohol and tobacco.
The federal government does not want to see you grow a medicine, even though it's an herbal medicine in that respect, because the pharmaceutical lobby does not want to see it happen. If we use medical cannabis, then it's only a matter of time until hemp is brought up in this country. Well, the lumber industry that grows a tree for 40 years doesn't want to see hemp, because you could grow a hemp plant in 6 months and get the same fibers out of it that you would from a tree that grows 30, 40 years. They make more money. So it's a monetary issue. And what I've noticed and what I've seen and what I've lived is it's a tremendous medicine. I mean, myself, I'm a successful stockbroker that, thank God, I've lived this long when I might not have, and I've got the right medicine.
Very sad that the way that marijuana was introduced into the United States was as a devil drug, as a menace, instead of as a potential healing agent, a remedy for all kinds of diseases.
That's our hope. That's why we do what we do. That's why we're public. That's why we do everything. We talk to politicians. We talk to doctors. We talk to everybody that'll listen to try to get somebody to study this plant. And it's a miracle. It's a miracle.
It worked with lung cancer. It's worked with other people's cancers. I've seen people's melanomas go away. People don't have to die. The government has to let go and say there is medical use, especially if it kills cancer.
If somebody discovered they make an extract out of petunia flowers and it kills their cancer, it would be front pages of every newspaper in the world. It would be headlines in all the cancer journals. It would be in the medical journals. It would be in the tabloids, for heaven's sake, if petunias kill cancer. But instead it's cannabis. It's marijuana that kills cancer. And where's the publicity?
Cannabis has been a medicine for 3,000 years. It has only not been allowed to be a medicine in this country for the last 70. I think we need to do what we can to reestablish its role as a medicine and allow physicians to have it in their toolbox for benefiting the lives of many, many patients.
Northern England, home of undulating hills.
Killed on the taxes.
I was going to say, there's a way I can buy the business. We set up a trust, and that's how we transfer